Safety in winter sports is definitely a talking point today, not only because of the tragic death of Canadian freestyle skier Sarah Burke, but today a study of children's helmets has been published in a pediatrics journal. The University of Ottawa and the Children's Hospital of Eastern Ontario compared helmets used in both high and low impact sports. And what they found out about ski helmets is troubling. CBC medical specialist Dr. Karl Kabasele joins us now. So Dr. Karl, what does this study tell us?
Well, you know, when kids are going out and skating or tobogganing, there's no particular type of helmet for those specific activities. So what these researchers wanted to know was, of the existing types of helmets, which are the best? They looked at ice hockey helmets, they looked at bicycling helmets, and they looked at skiing, downhill skiing helmets. And what they found was for, you know, sort of low impact potential head injuries, like you might get if you're falling down while you're skating, the hockey helmet performed the best. When you go
that makes sense.
And that makes sense, right? Because that's sort of what it's designed for. But what was troubling was for the higher impact possibility of a head injury from tobogganing, the ski helmet actually didn't perform well at all, but the bike helmet performed better. So
that seems counterintuitive in a way.
In a way it does, although a bike helmet, as you can imagine, when you're cycling, there's a pretty good chance of a high impact head injury, and therefore they're designed to absorb a lot of that impact. The problem that they found actually with the ski helmets was that they were not CSA, Canadian Standards Association, certified, and so that might be why they didn't perform so well.
So tell us a little bit about, remind us rather, just how dangerous brain injuries can be for kids.
Well, the most common type of brain injury for kids would be a concussion. So you can imagine with enough force, a head injury can crack the skull and cause, you know, serious sort of structural damage. But when the brain is shaken around in the skull by impact, it can cause a concussion. And we know that concussions, especially for the developing young brain, can have long-term effects. We only have to look at Sidney Crosby, who's an adult, to see that you can have long-term effects. For kids, it can lead to problems with learning, problems with concentration, and preventing them from reaching their full intellectual capacity.
And of course, Sidney Crosby was wearing a helmet when he was hit. Sarah Burke was also wearing a helmet. So what can we learn about the role of helmets and her death?
Well, you know, wearing a helmet is the right thing to do. Let's say that very clearly. Now, unfortunately, helmets can't always prevent injuries. What you're trying to do is reduce the risk or reduce the severity of a potential injury should you have a head injury. And so we still have to take care and be careful when we're doing these activities. There are certain kinds of accidents, like the sad one we've been talking about all day, where there's nothing really that you could have done to prevent it. But we should say that when we're dealing with children, particularly 6 years old and younger, they have underdeveloped skills physically, so they may be less able to protect themselves in the case of a fall or a collision.
You know, what's interesting about all of this is the fact that, of course, this is the coldest country in the world. Kids love winter, they love winter sports, but there's not actually an all-purpose helmet that exists for sale in this country, but there is in Europe.
That's right. And that's what these researchers are calling for, which is that, you know, for sports like tobogganing or skating, where there's no specific helmet for that, there should be an all-purpose helmet that covers off these low-impact type head injuries and also the high-impact. And if such a helmet could be designed as we have, or as they have in Europe, we'd go a long way in preventing a lot of these injuries.
Don't you think we have come a long way when it comes to actually wearing helmets? You and I were joking that we never wore helmets as kids, tobogganing, even skiing.
It's true. It seems funny that you know, we would ride bikes or do whatever we did without helmets. We know more now, and I think what we had failed to do in decades past is identify the potential for injury, and maybe we may have missed a lot of these injuries. Now that we know better, we've got to wear helmets to protect our kids.
Dr. Karl, thank you very much.
Thank you.
CBC medical specialist Dr. Karl Kabasele. It's a triumphant